furaha kweli siku ya leo.
My name is George Mochama. Ama kwa jina zingine naitwa Mochama wa HIV. I coordinate HIV program in Laikipia County. So for now, I want to report that as Laikipia, we are estimated to be having 11,552 people living with HIV in Laikipia. Out of that number, we are proud that we've been able to identify close to 10,000 of them, and they are currently receiving treatment in various facilities within Laikipia County. I'm proud to report that we have close to 390 mothers who are HIV positive and who are either breastfeeding or who are pregnant. Why it's so special for these mothers is because without intervention, they have 60% chances of infecting their children. But with intervention, these chances can be reduced to near zero. That's why we are here today to celebrate a portion of them who have undergone, 70 mothers are here today, who have undergone a process of following up their clinics, taking their medication, and after 2 years, they've graduated with their children who are HIV negative. The infection slightly higher for women, around 53%, and around 47% for men. So women have a slightly higher proportion of people living with HIV as compared to their male counterparts. In terms of age, again, is distributed across the board, but I want to emphasize that as Laikipia and also as a country, we are seeing an increase in the number of new infections among young people, adolescents and young people. And these are people aged between the ages of 10 and 24 years. That's where we are seeing an increase in new HIV infections. And it's a concern to all of us as a country, and more so to our county, because this is the generation that we are looking forward to have healthy population, people who can do their work, people who can live a healthy and productive life. So when we get increase in number of HIV infections among this population, then it's a source of worry. But then we have not taken it lightly, because then we have systems in place. We are trying to engage the much we can with the young people to enlighten them and give information on HIV prevention. Because I think over time we've always assumed that they know. But the truth is, we need to repeat this. Even for those who know, we need to emphasize, we need to keep talking to our young people around the issues of prevention and how they can prevent themselves against HIV. In terms of geography in our county, we have analyzed our data, and what we've seen is that 5 wards among 15 wards in this county contribute almost 70% of the HIV burden in Laikipia. These wards include those wards in urban areas that harbor the urban centers: Igwamiti, Maramnet ward, Nanyuki ward, I think Githiga ward, and Thingitho ward. So those 5 wards contribute the highest when it comes to HIV burden in Laikipia County. And simply because these are within urban centers, these are commercial centers for our county, and therefore they host a lot of diverse populations, people visiting for businesses, people coming for tourism, people coming for other economic engagements, and that's probably the reason why we have a higher proportion of people living with HIV among these urban wards within our county. The rural wards, the 10 of them contribute the least. Collectively, they contribute around 30% of the HIV burden in Laikipia.